he showed this phaco probe going so awkwardly, and I was saying, why are you making your life awkward? And I had discussed in the coffee time, and he said, this is what I do. So it's amazing. Thank you.
Yeah. We now move ahead to Dr. Bharti, as Bharti from Delhi, who would be speaking on what an ideal IOL should be. Over to Dr. Bharti.
Thank you, Dr. Rohit, and thanks the scientific committee for giving me this opportunity. I'll be talking about what an ideal IOL should be and what are the options available. The options are like holder, folder, the manual loading with push or screw type, and preloaded lenses. And here I'll be talking about the new lenses which have come into the picture, especially the new Nidec lens, which is I'm used nearly 1,000 lenses with amazing results. Factors to be considered is, first is the small incision size, and small incisions are part of overall visual acuity because the surgeon-induced astigmatism is smaller with smaller incisions. So 1.8 or probably smaller than that will be absolutely wonderful and will create least amount of astigmatism, creating a possibility of wonderful visual results. Now, IOL injection corneal wound. IOL injection has the greatest effect on incision stability because cornea's capacity for stretching or elastic is, deformation is limited, and as the cornea stretches, there's more damage to the architecture, causing more and more incision integrity is, damaged. So, variables affecting wound enlargement are closed versus wound-assisted injectable IOLs, the speed of insertion, the IOL power, and cartridge size and design. And as we all understand, when the IOL power is higher, there is more damage to the cartridge snout as well as the incision site. So that is another factor that even with this largest of power which you want to insert, the lens should be able to fold and go through the smallest of incisions. Another important factor is requirement of wound integrity, where lens which is the incision which is leaky can cause post-op potential hypotony, thereby increasing the possibility of fluid ingress, causing endophthalmitis at a later point in time. So that is again very important, that wound integrity should be wonderful even after the lens has been inserted. Post-implantation incisions, with less associated wound stretch is there with the wound-assisted insertion, but also the inserter plastic and the flexibility and smaller stout, which has got an inferior possibility of opening when the lens is passing through, is again a wonderful way not to allow the wound stretch in all these cases. Now, push type versus screw type injector systems, we all know that the push type are easier. Screw type requires a bilateral, bimanual, incision, injecting of the IOLs. So these push type injectors are much more suitable for ease of use by the surgeon. A screw type system, they allow a constant insertion speed and avoid resistance force, but they require both hands. So in these cases where the screw type systems are there, a mechanical system where it is automated system is considered a little better. So why do we need a preloaded delivery system? Because I am sure preloaded is better. It is consistent, predictable, and controlled insertion with minimal incision. This eliminates need for post-operative cleaning and sterilization. It is saving time because the lens is already loaded, and also eliminates the handling and misloading of the IOL. So that is very important fact when the assistants or the OT staff is doing the loading of the IOL in the inserter. Post-op endophthalmitis, as I said, the possibility of endophthalmitis is because they are handled in the OT, 1, and 2, if the wound is leaking and not very, it can allow the ingress of the fluid. So injectable IOL is, better and preventing the infections. The impact of a preloaded intraocular lens delivery system on operating room efficiency in routine cataract surgery is, a fact which is, well known. Using preloaded intraocular lens delivery system compared with manual pre-loaded IOL delivery processes during routine cataract surgeries were studied, and all the sites had pre-loaded delivery system, decreasing the mean total case time by 12%, which is significant when you have a large, OT list in your cases. So ideal preloaded IOL system should be optimized, designed for a small incision size, smooth passage of IOL through the device with minimum friction, thereby causing no damage to the IOL optics or haptics, smooth folding and unfolding, and very cost effective and convenient to use. So these are few factors, and also there should be more efficiency, reproducibility and safety. So in all these cases, this prevents the infection and cross-contamination and IOL scratches, and all these are available with the Nidec IOL, which I have been using. So I am very happy with these systems, and I am sure preloaded systems will ultimately become the preferred method of delivery. The refractive outcomes of a cataract surgery today are better than ever because of small incisions, high quality IOL materials, delivery system that act in concert with them. Injectors are a critical piece of procedure, and the only product that stays with the patient is the IOL, and the delivery system is responsible for getting it there. So all this delivery system has to be very perfect. Thank you very much.